Differentiating the roles of mental health service providers. When people think about mental health practitioners, they usually think of psychologists or psychiatrists, who are the most familiar types. But there are also mental health counselors, social workers, psychiatric nurses, and nurse practitioners, and several others who deal with mental health. Sorting through all of this can be confusing, especially to someone who is looking for help and is not sure whom to go to. But first, who is a mental health practitioner? A mental health practitioner is someone trained to assess and support people with common mental health issues, such as anxiety and depression, in the self-management of their recovery. The mental health practitioner will provide assessment and therapy for mental health issues and conditions. He or she will help you to better understand and cope with your thoughts, feelings, and behaviors, offer guidance and help improve your ability to achieve life goals, and help assess and diagnose mental health conditions. Besides offering assessments, diagnosis, and therapy, there are mental health practitioners with medical degrees who can prescribe medication to treat mental health issues and problems. Only licensed medical health practitioners are qualified to provide these services. All medical health practitioners are committed to helping people achieve and maintain mental health. The differences between them would be what conditions or mental health issues they focus on or specialize in, their medical background. Now, let's look at how psychologists and psychiatrists are different. A psychologist specializes in the study of behaviors, emotions, and thoughts. He or she is trained to evaluate a person's mental health using clinical interviews, psychological evaluations, and testing. The most common type of treatment used by psychologists is psychotherapy or talk therapy. Psychologists are not medical doctors. They do not have a medical degree and are not trained in general medicine or in prescribing medications. A psychiatrist is first and foremost a medical doctor or physician with a degree in medicine. The most common type of treatment used by psychiatrists is psychopharmacotherapy, which is the use of medication to adjust levels of brain chemicals to treat mental conditions. They may also provide some counseling and might refer a patient to a psychologist or therapist for additional counseling or therapy. Other mental health practitioners are counselors, clinicians, and therapists. They are master's level healthcare professionals trained to evaluate a person's mental health and to use therapeutic techniques based on specific training programs. It is important to note that psychiatrists and psychologists often work together. A psychiatrist might make an initial assessment and diagnosis, then refer you to a psychologist for psychological treatment, for example, talk therapy, or vice versa. Psychiatrists and psychologists also work together in hospitals as part of mental health teams. There are also non-professional mental health practitioners who offer psychosocial support, such as social workers, peer counselors, informal community caregivers, mental health advocates in their organizations, and other mental health workers providing support under the supervision of a mental health professional. When choosing a healthcare practitioner, the following need to be considered: specialty, training, methods, schedule and availability, convenience. Having the awareness and understanding of the capabilities of different mental health care providers is a good step towards getting the help that we need for our mental well-being. Hope this helped you feel more confident to reach out and ask for help.